Hello, and welcome to the Atlanta Heart Podcast. My name is Lincoln Parks, and today I am here with Dr. Camille Nelson. Dr. Nelson, welcome to the podcast.
Thank you. Thank you very much.
So, Dr. Nelson, I just wanted to jump in real quick and get started with you and ask you, for those that are going to be watching and listening, just give us a little, a brief background about your history, how you got started in cardiology, and really what interested you in that area.
Okay, sure. I was born in Trinidad, West Indies, but I came here as a 6-year-old, and I grew up in New York. And went to school in New York, went to medical school in Albert Einstein in the Bronx in New York. And then I trained with my internal medicine training in the Bronx in the Jacobi Medical Hospital. And then I did my cardiology at North Shore Hospital in Long Island in New York.
Okay.
And then I came down here to Atlanta in 98. I've been here ever since.
98. And you did mention early that you were from Trinidad, and that's such a coincidence because I knew it was something because I'm also from the Caribbean. I'm from the Bahamas, so you got that island flavor going on.
Oh, yes.
Yes. So
So in
Dr.
terms of,
Camille,
I'm sorry, you asked me about how I got into cardiology.
yes, how did you get into cardiology?
Actually, when I was in, I guess, junior high school, for some reason I did a project on the human heart in junior high school, actually. And
Wow.
then I went to a high school that actually had a pre-med program, one of the few high schools in New York that had that. And so that sparked my interest. And then when I did my residency, there were a lot of female residents who were going into cardiology. So I felt comfortable doing that.
Wow. I mean, that's amazing that, you saw that interest early on since, junior high and then just kept that all the way through. Usually people, when they're interested in something in junior high, by the time they graduate high school, they're done and moving on to something else. So, that's amazing. So
Yes.
I wanted to talk to you a little bit about your article. Well, you were referenced in an article by NBC News, and in that article, it was talking about African Americans have the highest rate of death from heart disease, and could more Black cardiologists help out in that field? So I wanted to ask you, and just referencing this article, it talks about the disproportionate amount of impact of heart disease in the African American community. So can you elaborate a little bit more on some of the factors that are contributing to that?
Yeah. So basically, some of the risk factors for heart disease: high blood pressure, diabetes, cholesterol issues. But there are a lot of environmental issues also, and social issues that lead to African Americans, or people of African descent in this country at least, um, with an increased risk of heart disease. So where we are here in Atlanta, this is considered the stroke belt, and a lot of it has to do with cultural, food, societal issues, and so it's not so much a genetic thing. Some people feel like
Right.
genetically programmed.
Right.
I think it's more what's been known to be what's called now the social determinants of health, which there have been a lot of studies recently talking about that increases the risk of heart disease, and that has to do with the impacts of wealth and health and access to health, rather, economics, things like that, environmental issues that disproportionately affect the African American population in this country, and I
Yes.
think why we see that difference.
So, and just touching on that a little bit, I know, being from the Caribbean, I know we it's peas and rice, it's macaroni and cheese. It's we got the fish, we got the and we the fried fish, and we got so. a lot of people, I've been in conversations with a lot of people also where it's sort of like, some people are saying, oh, it's just in your genetics, but no, like you mentioned, it doesn't have anything to, not much to do with that, but the socio and economic background, or where you live, and those kind of things. So why do you think, a lot of people still have that misconception of, it being genetically based?
Well, I think that's probably what we've, been taught over the years. But I think that, there have been studies done with not just the Black American population, but different populations in this country as opposed to other countries. And you can see differences in health that come into play.
Gotcha. So a follow-up question to that is, how can cardiologists like yourself, build trust and rapport with African American patients to encourage more of that, preventative and care early on?
Well, again, not just African American doctors. I mean, I think all doctors, no matter who we see and who we take care of, you always have to talk to the patient. That's the first thing that we learn when we're in school. You have to talk to the patient, understand what their life is like, and what their background is. And so with any patient, you're going to want to know what's the best way to approach that patient, to best relate to that patient. So you don't always have to be from their community, right? So the African
Right.
American population in the South can be different from the North, Caribbean population, from the continent of Africa. So you just have to be able to relate to the patients, but you have to be open-minded and not be rigid about just putting people in different boxes and just assuming you know what's going on when you walk in the room. So you walk in the room with an open mind, speak to the patient, and then you take it from there.
Absolutely. So, Dr. Camille, I may have to schedule an appointment with you because, okay, and I'm just being real right now. So, high blood pressure. You mentioned high blood pressure, cholesterol. These are things that a lot of people, and from what I'm hearing, you educate me. These are silent killers, right? So these things creep up on you, and my father, just this might have been 2 years ago, passed away from heart failure, right? And so, like, what would you recommend? Like, where do we start? Is it, I'm on high blood pressure pills, cholesterol pills. So what's the next step? Where do I start?
Well, I see patients like that every day, right? Just finished seeing a couple of them just today. And so, again, you kind of have to take a holistic approach, right? So you come in, you talk to them, you see who's with them, if somebody's with them, you interact with them a little bit, see what their life is like. We talk about their medications and whatnot, but I focus a lot on what's going on in terms of what they eat. Blood pressure is a big deal, right? So,
Right.
I just saw a patient today, and we laughed and talked about him eating all his bacon and stuff, right? Because he's got blood pressure and cholesterol issues, and he was proud enough to say, okay, that he's cut out the bacon, he's still eating the fried chicken. So we work on the fried chicken. So I don't chastise him. I said, okay, you did great without the bacon. Now let's start to cut back on the fried chicken. And
Yeah.
sometimes we talk about family, what's going on, what's the stress. They might tell me about their wife or their kids or their grandkids, and we'll talk a little bit about that. So again, social determinants of health, it's a broad base. You don't want to just focus, okay, here's some pills and go home, right?
That's right. That's
So
right.
right. So you just talk to the patient, find out what's going on with them, and then you try to tailor the medications according to what their other medical conditions are, right? So if they have
Right.
diabetes, you're gonna use a certain amount of medication, something different. If they have other medical issues, you're going to use a different type of approach in terms of your medical therapy. But I find that I focus on what their activity is, how active they are, or inactive they are, and try to encourage them that way. So again, you don't want to just be a pill pusher, right? You want
Right.
a holistic approach to taking care of the patient. So
That's
with your
awesome.
dad, or we talk about food, we talk about medications, we talk about side effects. Very important. Patients sometimes don't, take medicines for side effects reason. They're concerned. Patient of mine told me today, oh, I think this medicine I heard it causes cancer. I don't know where you got it from, but we discuss it, and then we work with it. But again, you don't want to just go in there and say, okay, here's X, Y, and Z pill, and then you forget about everything else.
Absolutely. And that's a great approach. And I'm glad that you do that and take that approach, for all, like you said, all of your patients, doesn't matter, who they are. So, can you sort of discuss, the importance of maybe community outreach programs, in promoting heart health and awareness, in all the communities?
Yeah, that's important. I think there's a lot of there's some programs, particularly the Association of Black Cardiologists do a lot of outreach programs. They do some set up shop, beauty shops, hair salons, things like that, where they just even check blood pressure, or they do a little bit of information, like pamphlets and stuff like that,
Yeah.
and really just educating even somebody is like the local barber, or things like that, going to schools, things like that, reaching kids early on, talking
Right.
about the importance of dietary changes, because that's a big deal in all populations, but particularly Black American populations, the importance of dietary changes, because a lot of that is cultural, so you want to get that early
That's
with
right.
the kids. So there are a lot of outreach programs that deal with that.
Awesome. Awesome. So do you think, at Atlanta Heart, what are some of the things that you guys are specifically doing, if you know right now in the community?
Yeah, there's some things online. We have a lot of things on our website online for patients to log on to get a lot of information regarding their medical condition, whatever diagnosis they have, so that they can get some information linked to the Mayo Clinic, so that they can get some information. We've done some outreach stuff to go into, I was sitting one day and we went out to Chick-fil-A. We sat there and checked blood pressures, free blood pressure checks, while the
Yes.
folks were eating their fast foods at Chick-fil-A, and letting them
Yes.
know what their blood pressure is, so that, they can get it addressed. So those are the kind of things we do, some hands-on things like that. And we do some church things and things like that in the community. But also we try to encourage some online things so patients can just click on, because everybody's got their phone and their laptop, and
That's right.
that's
That's
how they
right.
communicate these days.
That's right. So in wrapping up, our conversation, Dr. Nelson, has been like, so great to hear, what Atlanta Heart is doing in the community, and specifically what you're doing, with your patients, and helping them out. Do you, this being Women's Health Month, or like, do you see a disparity, with men and women, when it comes to heart health?
Yeah, definitely. I think a lot of women we see are so busy taking care of, either their family or their partners, that they sometimes neglect their own health. I see a lot of patients themselves. They'll come in with their husbands or their mom or their dad, but they're the ones who may not be taking care of their own health.
Mm,
So we want to encourage, particularly in Women's Health Month and things like that, to encourage women to take care of themselves first, so they can take care of somebody else after the fact. Because if they're
yes,
not in good health, they're not going to be able to take care of anybody else.
absolutely.
And encourage women with, particularly
Absolutely.
in the pregnancy, to make sure that they monitor their blood pressure and get the regular checks, so they don't run into issues, because that's a big risk when they have problems during pregnancy, that increases their
Right.
risk down the line for high blood pressure and heart disease, and we're seeing that a lot. So
Yes.
maternal mortality is a big deal, particularly in the African American population. So again, want to get the information out to the folks while when they're young, and
Absolutely.
particularly women in childbearing age.
Yes, ma'am. So, one last question for you, Dr. Nelson, and that is there any um, thing that you do that, from a health perspective, or you go on a walk, or whatever it is, but is there anything that you do specifically for your own health?
Um, yeah, actually, well, yeah, every morning I get up and I get on my little exercise bike. That's the first thing I do while I watch the news and I scroll through my email or whatever. First thing I do in the morning. So
Yes.
I get my little 20, 30 minutes out of the way. So at least I've done the bare minimum. And then
That's
after
right.
that, I can do something else. I can go on a walk or, go to the gym or, whatever. But, if you can work it into your schedule where it's first thing in the morning, you just do it and get it out of the way, it just becomes a routine. So
That's right.
I
That's
barely
right.
open up my eyes and boom, I'm already on the bike for my 20 minutes. I'm watching what's going on in the news and reading my phone. So I'm doing 3 things at the same time. But I
That's
get
right.
it out of the way 20 minutes early, and then after that, everything else is it's gravy. But at least get that 20, 30 minutes in. And then I encourage patients to do things, not just something boring like on a bike, and said, oh, I'm gonna go to the gym and the treadmill is so boring. I said, well, go take a walk, go outside, take your husband, hold his hand, go around the
Right.
block. You're 20 years old and stroll and talk and enjoy outside, go dancing, things like that. I tell my patients, hey, just put your headphones on and your 20, 30 minutes of your best song and you go dancing in your room, and that's your 20, 30 minutes of exercise right there. So it
That's
doesn't
right.
have to be anything boring or you got to get a special outfit to get on there. You just, go do something to get the heart moving a little bit for the day. And that can encourage you to do some more activity later on. But just get your little 20, 30 minutes in every day. Make it part of your routine. And then everything else after that is even better.
Awesome. So, Dr. Nelson, I truly appreciate you being on today and sharing, your insight on heart health and also, some preventative ways that, people can just start, getting themselves prepared and getting themselves healthy, and just really taking your advice and putting that into action. So, if you're listening or you're watching the podcast, I definitely want you guys to schedule an appointment with Dr. Nelson and make sure you go in and you ask for her and speak to her specifically so she can help you guys take the next step in your heart health journey. So again, Dr. Nelson, thanks again for you being on. Truly appreciate it.
All right. Thank you very much. Bye-bye.
Take care. Bye-bye.